Hello and welcome back to this edition of Bayou Time. I'm your host, Keith Weiss-Ike, licensed clinical social worker. Thank you for joining us. However you may be joining us, we appreciate it. You know, I get really excited to be able to talk to people who are a whole lot smarter than me. And we're always very glad to bring in some of those experts. One of those works at Terrebonne General Health System. We welcome Dr. Uga Azima.
Yes, sir.
Thank you. Well, I appreciate it. And look, my last name's Weiss-Ike. Nobody ever gets mine right. I appreciate you making it a little easy on us. But pulmonology and critical care specialist. And you've been in the area for a while, pretty new to Terrebonne General. Tell us a little bit about you.
Yeah, of course. Thanks for having me here. I'm Uga Azima. I'm originally from Nigeria, grew up in Jamaica, went to Nichols.
Oh, cool.
And have essentially been around since then.
Okay.
Just finished my training in pulmonary critical care at Tulane. I did my internal medicine residency at Shabir Medical Center.
Right, great place as well.
And I've had an affinity for this area ever since then, and happy to be here.
Fantastic. And the food's not bad, right?
The food is absolutely not bad.
Well, listen, one of those things that I know you guys are seeing, we're seeing kind of this uptick in COVID, but can you tell us a little bit about the Omicron variant itself so we can get a little better understanding about it?
Absolutely. And I think by now everybody knows about COVID in general.
Right.
The variants are interesting in the sense that, let's talk a little bit about how we've been naming them thus far.
Okay.
The Omicron variant, the variants have been named based off of the Greek alphabet. Omicron being the 15th letter of the alphabet. You guys are probably more familiar with Delta, which came before that, the predecessor to Omicron. Right now, Omicron is the most prevalent variant in really the country, but specifically to Louisiana is the most prevalent variant in the state.
And that was one of the things I was thinking about. And so do we know kind of where it originated? Did it kind of start somewhere else and just kind of come to here?
Yes, sir.
Okay.
It started in Southern Africa, in South Africa, and in Botswana. That's when the first cases were found.
Okay.
The first case that was isolated in the United States was on December 1st of this year.
Oh, wow. Okay, so that's pretty recent.
Yeah.
And so we kind of see if that one's the most prevalent that we're seeing. And so it is truly the most prevalent in the state now.
Yes, sir. It's the most prevalent in the state right now. Chances are, if anyone has COVID at this time, the most likelihood that it's Omicron is pretty high.
Okay.
Yeah.
And it presents a little differently, right? Are we seeing, tell us a little bit about the difference between this variant and maybe the Delta variant that preceded it.
Absolutely, some subtle differences here. In our experience, we've seen that it's a little bit more, or significantly more, to be honest, more contagious.
Contagious, okay.
More infectious.
Okay.
And it's spreading a little bit faster than Delta has been. Now we need to wait a little bit to get some more information. Mm-hmm. As you can see, it's barely been a month since the first case came to the United States, but from the evidence that we've seen so far, from the data that we've seen so far, it's definitely more infectious, more contagious, and having a wide variety of symptoms that you'd expect with any COVID variant.
Okay. And I know that, Delta very often was about fever and a loss of smell and loss of taste. Are we seeing a lot of those same things with Omicron?
Yeah, you're seeing just about the gamut, the spectrum of infection, symptoms that you're getting with all of the COVID infections and variants.
Okay.
Fever, chills, night sweats, cough, shortness of breath. A lot of some patients may just get congestion and runny nose, headaches, chest pain. These symptoms have essentially been generalized across all the variants.
Okay.
And nothing more specific to any particular variant. But like I said, we're all still getting more information. This is pretty new to us as well. Yeah.
Right. Can't really do a longitudinal study on something that's only been around about 30 days.
Exactly.
But knowing that, and I'm very fortunate, very thankful to live in this area, and you can tell that I'm still a little stuffy. Started with a runny nose and started with a headache and some congestion. So I immediately talked to my healthcare provider through Terrebonne General Health System, and he said, I'm going to order you a test. I want you to go. And he ordered me all three to rule out for both flus and for COVID.
Yeah.
And fortunately, I didn't have that. So my question is, are you seeing or hearing, certainly as somebody as a pulmonologist, some people that are having some of these maybe cold-like symptoms or maybe head cold or chest cold symptoms where they're thinking that maybe it is Omicron and maybe it isn't?
Yeah, absolutely. And now we have to remember we're still in flu season.
Right.
We're in peak flu season now. So Right now, we are seeing a lot of patients that are having flu separate from COVID. And a lot of those symptoms overlap as well. So it's important that if you're having any of those symptoms, you should probably check out and make sure, get tested, isolate, quarantine if you have to make sure that it's not the COVID variant, because there are treatment options depending on what it is.
Right. And I want to brag a little bit about how easy it was to get tested.
Yeah, at Terrebonne General, we have a testing facility, a drive-through testing facility, where you can, for a couple things you can do over there. You can get tested, and you can get your vaccinations there as well. I'm also very proud of our drive-through testing facility. So if you get the chance and if you're concerned, it's really easy. You just go on through, we get the test, you get your results, and you know where you stand.
Yeah, and I will tell you, I will brag on that. It's it's better than most fast food places. You got an option to drive up. You can go to the right and get your COVID vaccination, or your second one, or your booster.
Yep.
Or you can go left and you can get tested for COVID and or the flu. And depending upon what your doctor feels like you need to get ordered.
Absolutely.
But it was a very, very easy process. And so when you guys talk about that, I got to experience it firsthand.
I'm happy that experience is what you've experienced, and I think that's the experience most, if not all of our patients have gone through that drive-through. Yeah. It's really something that we're very proud of.
You mentioned a little bit about how you kind of came in. You've been trained in here, and you've been here, but COVID has presented some issues and problems, but IDA presented a rather unique subset of changes.
Absolutely. IDA presented an opportunity, really, to reset the population, reset the hospital. Granted, it had been pretty catastrophic, and I have to give credit to Terrebonne General, how well they've been able to rebound. The facility, the administration, they have been absolutely tremendous.
Yeah. Especially with all the damage and the impact of the personnel.
Absolutely.
Both of those things.
We're happy to now be up and running 100%, making sure everyone is working and trying to get everything back up to par.
Right.
With regards to COVID, obviously the cases had fallen off since then, but we're noticing, especially with the Omicron variant, that there's a slight uptick now.
Right.
And so we're just keeping an eye on that, and we're expecting that, especially with the Christmas, Thanksgiving season that just went by, we're expecting that to continue to trend up.
Right. And I know we don't have very many patients in the hospital right now on COVID. Does that, and you've talked earlier a little bit about the fact that Omicron is a lot more contagious. Are we finding that it's not as severe, or are we doing a better job at treating it?
I think that's a very good question. I think it's probably a combination of both.
Okay.
I think we're treating our patients a lot better, and I think on the front end, more people are becoming more vaccinated, or more people are getting vaccinated.
Right.
People are exercising, judicious means of wearing the mask, keeping the social distancing. I think we as a population are a little bit more educated about how to go through this pandemic on a day-to-day basis. And I think we're a little bit more experienced as a people, and we've been taking care of each other, and we've been very mindful about taking care of each other. But like I said, I think it's a good combination of both. We're treating our patients better. We have a better grasp of how to take care of these patients. And on the front end, we're doing everything we can to prevent folks from getting the infection in the first place.
Okay. And are we seeing the administering of the infusion and how that has helped? Are you seeing some of that?
Yes,
Okay.
we, especially with the previous variants,
Okay.
Delta. And the original COVID. The more data needs to come out with regards to Omicron, with regards to the infusion for Omicron. But right now, we're just waiting to see how that plays out.
Right, and it's really interesting. I don't know, we're not a very patient people, but sometimes we've got to wait. We've got to wait and see what the data is telling us before we start trying to treat too quickly.
Exactly. We always have to weigh the risks and benefits, and we always have to we try to practice evidence-based medicine. So having data that guides us to doing the right things and prescribing the right things and treating our patients appropriately.
Right. And so if somebody thinks they have symptoms, what's their first step? What should they do first?
The first thing is get tested.
Okay.
If you think you're having symptoms, get tested, isolate or quarantine. Especially if you test positive, I would say isolate. And there's a difference between isolation and quarantine.
Okay.
Quarantine means you wear a mask in public places. You try to be cognizant of who you're around when you're around. Isolation is very strict. Isolation is a little bit stricter. It's
Okay.
being in your own private area. Try to, if you're with your family, stay in a particular room. Try to use one bathroom. So that's isolation is a little stricter than what quarantine really is. You quarantine when you suspect you've been exposed. You
Okay.
isolate when you're confirmed to have the infection.
It's a great perspective on knowing what the levels are.
Yeah.
When I got it last Christmas, not this Christmas, but last Christmas, my wife quarantined herself and isolated me.
Exactly.
And so I think that's kind of the right thing to do if you can do it.
Yeah.
You know,
If you can do it, of
right.
course.
And so masking is still very, very important. Correct. And keeping enough distance.
Yes. Masking is one of the primary, along with vaccination, primary ways we try to limit the infectious rate of COVID, no matter what the variant is. Masking is helpful. I would always recommend masking. The way I think about it is, at any given moment, you don't know whether you're vaccinated or unvaccinated. You actually don't know unless you just got tested. You don't know whether you or whoever's around you has this virus.
Right.
And masking helps to curb that infectious rate. So I would always encourage masking when possible, especially in indoor public areas.
Indoor public areas.
Yeah.
We got about a minute left. Is there anything in particular, as a wrap-up, you'd like to kind of share with the public to let them know either about what you do with work or about Omicron or about Terrebonne General?
Well, I'll go back to Terrebonne General,
Okay.
Especially our drive-through testing facility. I cannot praise what they're doing there more. I would recommend anyone, if you're infected or if after talking with your doctor, you've decided to go ahead and get the vaccine, or if you've already vaccinated and you need a booster, I cannot emphasize enough how easy it is, and you can testify to that.
Yeah, it was very, very efficient. And so, again, just a shout out to what they're doing and the programs that are working. And
Yes.
so thank you for being a part of those programs that are working. And thank you so much for joining us today. We really appreciate it.
Thank you. Thanks for having me. It was my pleasure.
All right. And again, that's pulmonologist and critical care specialist, Dr. Azima. And that will take us for this particular segment of Bayou Time. Don't go anywhere. A lot more to continue when we return.